This is Dr. Stephanie on behalf of Coherent Health, here with another episode of Must Know, from my modality to yours. In this webinar series, we talk with health and wellness practitioners from all modalities about the things that they think you should know to benefit your clients. Today, I have with me Marlene Handler and Danielle O'Connell from the Lifted Lotus, a holistic pelvic floor therapy practice based in Brooklyn, New York. Marlene.
Hi, everyone. I'm so happy to be here, Stephanie.
Thank you. We are so happy to have you. Marlene is a licensed pelvic floor occupational therapist and founder of the Lifted Lotus. Marlene is dedicated to helping individuals overcome pelvic health concerns, expand their body literacy, and improve their quality of life. With over a decade of experience as an occupational therapist, Marlene offers personalized and holistic care tailored to promote healing, balance, and overall well-being. Outside of running her own practice, is there an outside of that really? Marlene loves spending time with her family, being in nature as much as possible, and adventuring around the world. Danielle.
Hello, thank you for having me.
Hello, Danielle. Danielle is a licensed pelvic floor occupational therapist as well, and lead clinician at the Lifted Lotus. She uses her empathetic nature and passion for women's empowerment to provide quality holistic care to those dealing with pelvic health dysfunction. Danielle's experience as an OT in varied settings and person-first approach encourages a unique provider perspective and the ability to collaborate with her clients to determine the most effective healing process. In her personal life, Danielle enjoys live music, dancing, tending to her plants, and playing with her cat, Willow. So lovely to have both of you here.
Thanks for having us.
Our pleasure. I would love to begin by asking you the question I've actually asked you before in real life, which is if in telling us about the Lifted Lotus in your practice, you could also help us understand the difference between pelvic floor physical therapy and occupational therapy.
The $1 million question. So the Lifted Lotus is, I say, women's health focused, vulva owner focused, pelvic floor therapy practice, really dedicated to transitional times throughout life. Pregnancy, postpartum certainly being one of the biggest, perimenopause, menopause, all through the lifespan, but really dealing with pain conditions and an array of pelvic health concerns. Occupational therapy specifically, as it sort of compares to physical therapy, our foundational training is a little bit different. So we're really looking at, which we'll expand upon later in the talk, but we're really looking at sort of who is this person, what is their environment, and what are all the factors and roles and responsibilities they have during the day, during each day, right? So person, environment, and the systems and roles and responsibilities, right? So that is our lens through OT. And so to bring that into pelvic health, as pelvic floor therapists, we're trained similarly across the board with physical therapists. It's just that our foundational training is a little bit different and by nature, very much holistic. So we're looking at nervous system, we're looking at breathwork, we're looking at, what's meaningful to this person, what are they responsible for in a day? Not just looking at like physical ailments or physical limitations. That's sort of like in a nutshell.
That's a very holistic nutshell.
Yeah, I hope that was clear.
Yeah, super clear. And I'd love to learn even more about how that lives within the Lifted Lotus and what you offer to your clients who come visit you.
Yeah, I mean, a little bit of everything. Really a little bit of everything. Like I would say we're really looking at like behavioral patterns, lifestyle, kind of where we can modify within, lifestyle factors, nutrition, water intake, what are they consuming in a day? What's stressing them out? How are they managing the stressors, right? So it's like body work, nervous system work, certainly pelvic floor integrated work, whether that's manual work or pelvic floor focused exercises, breathing techniques, self-care, ways to communicate better with their partners, ways to communicate what their needs are around their roles and their habits, It's a really, I mean, the scope is very broad. I don't know if you have anything to add, but.
I was just going to add that specifically at our clinic, our initial evaluations are 90 minutes. So we get the chance to speak about, touch upon, understand the person that's sitting in front of us and how their pelvic floor concerns are affecting their entire life. So with this one-on-one individualized approach, and you stay with the same clinician your entire therapeutic journey, that allows us to really fully understand the person and treat them in the best way according to their presentation, not some sort of like pre-written protocol that we come up with.
I appreciate that. I appreciate that professionally and integrative approach, and personally as an individual and as a mom of 2 kids, who's sometimes still searching for her pelvic floor. That
right.
It's not just a bowl of muscles. There's so much more that it's connected to, pun intended. So, from all of this, from your breadth and wealth of expertise, what do you think is most important for other health and wellness practitioners to know on behalf of their clients?
So I think foundationally, I spoke on this already. The most important thing is who is the person sitting in front of you, right? Like just touching on what Danielle said, there's not a protocol. There's not a formula, right? It's a lot of intuition. It's a lot of meeting that client where they are in that moment. And so who is the person sitting in front of us? Like, what are they responsible for in a day? What does self-care look like? Do they, what's important to them, right? So again, just through that OT lens, we're like sitting there talking to them. What are your concerns, right? What are you here for? But then let's talk about it in like this bigger sort of macro sense. Like, you're here for pain with intercourse, but you're a mom of 3 children, you're a full-time working employee, you also are a caretaker for your parent, right? So yeah, of course you're having some difficulty with something that's just as common as sexual health, right? It's a very important activity of daily living for people and really, really integral to people's well-being and quality of life. So we're really like, who are you? Who are you and what is important to you? And like, how do we get you to sort of from point A to point B with all of the context of these other things that you have to manage? You have other things to add?
Yeah, I think that was really great encapsulation of what probably our foundational primary concern is in the clinic. My only additional point would be how these symptoms or their kind of daily functions are affecting them personally in their bodies. So it could be, we see a lot of women that are pregnant, but each person's pregnancy experience is very different to them and how it affects their body, their nervous system, their functioning in the world, their social relationships. So I think that's very important to understand. Yes, you could have the same clinical diagnosis or presentation, but within the person, it's a very different experience from person to person. So I think that's very important to note as any sort of provider or clinician.
Yeah, the importance of the individual as the individual and seeing them as more than whatever label or diagnosis comes walking through the door. Before we get to the other things you want to share, just curious, in terms of individuals walking through your door, do they know what they're getting in for? Like, do they know how holistic your approach is, or do they conflate it with more of a traditional physical therapy type approach? Or
I think that's a great question. Yeah. I would say it's split. I think some people that are looking for a more holistic practice find us. I mean, it's helpful that it's in our name. But I would say others, when they come, for the most part, are very pleasantly surprised when we start to ask, okay, so what is your partner relationship like? How are you sleeping? What does movement feel like in your body? Rather than just looking at that clinical component. So I would say maybe half expected and then half are pleasantly surprised.
Yeah, I would agree with that.
It's a pleasant surprise and a very valuable offering. I get asked many times about holistic type of women's care. So I'm very happy to know about your work.
Thank you.
Yeah, thank you.
What else would you like to share with our fellow wellness practitioners
Yeah, so one of another big one for us as OTs, I would say specifically, is asking the client, what are your goals for coming here? And what's realistic within your life? I can't tell you how many providers I've been to that I tell them kind of my narrative of what's going on, and they say, this is what we're gonna do. They don't, I won't mention any names, but I've even worked with many pelvic floor therapists myself, and PTs and OTs, and some of the PTs have been like, well, what exercises do you want to do? And I'm like, I just want to have comfortable sex. I want to have an orgasm. I want to not pee my pants when I go out to dinner with my friends. And they're like, well, do you want to do jumping jacks? Do you want to go on a run? I'm like, no, none of those things. So I think for us, again, as occupational therapists, we're like, what are your goals for coming to see us? And like, maybe it's to have sex that feels better. Maybe it's to not have any urinary leakage and have a social life, right? And then we're like, okay, we might have a plan. Like, okay, let's try once a week for a couple of weeks. But what's realistic in their life is not once a week for a few weeks, right? Financially, time, like if they're doing, taking care of 3 kids, working full time, caregiver, they can't commit to therapy every week, right? So it's like, what are your goals? What's realistic for you? And then we have to come up with a very creative plan. Again, who is the person in front of us and what is realistic for them, and trying to meet their goals, not like what we think their goals should be, right? Not like something physical, like not to get back to getting on your Peloton, but like you want to go out to dinner with friends without peeing your pants. Okay, let's start there, right? And really breaking it down. Yeah,
I completely agree with that. I think it's empowering them to identify their goals and recognizing how functional they really are within the scope of pelvic floor therapy, and then encouraging and finding ways to really promote them to use the tools within their lifestyle. So just to expand upon what you said.
Yeah, I see similarly within my practice. I believe convenience is king, and ultimately you can have the greatest game plan in the world, and even one that's totally aligned with the individual you're working with. But if it's not actually doable, if it's not practical within their 24 hours in a day, it's just not going to happen. And it's such a simple step toward self-care, but not always the easiest.
Mm-hmm.
You mentioned a couple concerns like sexual health and urinary incontinence. Are those the primary ones you see, or what are the popular pressing concerns these days that you're seeing?
Great question. Certainly urinary leakage. That's a big one with our postpartum, even our pregnant clients. Low back pain, pelvic heaviness or pelvic pressure, like prolapse type symptoms, pelvic organ prolapse. We see a lot of clients with endometriosis, so managing pain with endometriosis and pelvic floor tension because of endometriosis and having that like chronic pain condition. Perimenopause, vaginal lubrication, sex that doesn't feel good, low libido, difficulty having an orgasm. So many.
Yeah, I'd say a lot. Sexual health is a huge one, like painful penetration.
I would say that comorbid with almost every condition we see is digestive issues, which I'm sure you see a lot in your own practice, but like I can't even tell you, people like fill out the intake form and they're like, oh, I just have urinary leakage, or I just have sex that hurts or sex that doesn't feel good. And then when they start to do the intake, it's like constipated, straining to have a bowel movement, inconsistent bowel movements, blood in the stool. So it's like we're seeing so much of the time that there's digestive GI issues and these other things, right? Because it's often like activates the stress response, cortisol sort of lowers digestion and bowel motility. So yeah, that's a big one. I mean, almost with every client we're talking about like hydration and toileting posture and breath and all of those things.
Yeah, it really is all connected. I think it's become almost too easy in our society to talk about the body structurally.
Yeah.
Which does exist, that is real, and it's also all connected. Whether, let's say, through organ systems or hormonal systems, or just regionally, like when you open up a cadaver and dissection, there's not a wall between the upper abdomen and the lower abdomen and the contents therein. But if you don't know, how do you know, right? Anyhow, speaking about knowing, is there anything else you would like to share about things other practitioners should know for their clients?
Yeah, I think one of the most basic that I think many practitioners are focusing on now is just breath and how available and free breathing is to us, right? We forget, and it's like all day we're talking about breath and breath awareness, and that it's a tool that we can use at any point of any part of our day, and it's completely free, and we don't need an expert to show us how to do it. And just how integrated that is to like overall well-being and self-care and stress management and nervous system regulation. And sometimes when somebody comes in front of us and they're really upregulated, just having them put their feet on the floor and close their eyes and breathe into their belly or their diaphragm or their pelvic floor can like change the entire sort of course of a session and change their day pretty tremendously.
Yeah, absolutely. It's kind of fun to start a session with that, with just a little bit of regulating breath work, because usually people are coming here from work, from another event, from something going on, and it's like, no, this is our chance to really settle in, ground ourselves, and then have a very mindful session to follow. And then it's like, oh, this works. Like there's some buy-in immediately. And then they're able, oh, this is one of my tools. And like you said, it's free, it's accessible, and it's pretty discreet too. You can really use your breath throughout the day and not worry about making a scene or having to stop to do a stretch break. You can really tune into your breath mid-conversation. It's really helpful.
It's a great reminder, likely also for practitioners to just be
Oh.
breath for themselves, right? Not just the clients as a game shifter, but for the practitioners to take a moment, because just as the client is rushing in from XYZ, and you guys are in New York City, so they are rushing in from XYZ, the practitioner is also probably just coming from something else, and just to demark that transition point with the breath. I was just thinking when you were speaking before, though, how much of it is forgetting to breathe versus not even knowing how to breathe properly anymore, right? And that breath is, and I think any breath is a great first step, but there's the difference in the clavicular breath, which I would argue a lot of folks in our modern go-go-go society are taking versus a fuller, diaphragmatic chest breath.
Yeah, agreed.
Yeah, I love that you guys are breathing. I love that you're breathing.
We love that we're breathing too.
Yeah.
We're all here, in fact, because
Right.
you are breathing. No, I really appreciate the approach. I appreciate the multidisciplinary and multimodal approach to your work and how it is tailored to. It really takes into account the individual sitting in front of you, and not just who that person is, but how that person lives their life.
That's a big one.
Takes all these things. Yeah. Anything else you would like to share with our wonderful viewers today?
I think the only thing is that just, without pelvic health, there is not a quality of life. So without awareness of your pelvic floor and all the functions that your pelvic floor is responsible for in a day, like peeing, all sort of bladder health in every sense of the word, bowel health in every sense of the word, sexual health in every sense of the word. Those are like the most fundamental activities of daily living, right? Going back to our OT framework. And if they're not in sync and harmonious, if one little thing gets, if you're not having a bowel movement every day, or you're peeing your pants, or sex doesn't feel good, your quality of life suffers. So I think just in general, pelvic health in general, there's not enough of us doing this work. And we need to like shout from the rooftops that everybody has a pelvic floor in the whole world. And when you have dysfunction, it really disrupts your quality of life, and there's help for you, right? There's help. There's people like Danielle and I and practitioners that do a lot of pelvic floor focused breath and movement that are out there, and use us as a resource, you know?
Yes, cheers to that. I don't think a lot of people are aware of the pelvic floor, the nuances, or even how, without having acute dysfunction, we're probably chronically dysfunctioned just by virtue of how we sit, right? And how much we sit. And back to the modern lifestyle again, it's not inherently supportive to a healthy pelvic floor.
That's absolutely right. Yeah.
So thank you for your work. Thank you for sharing your work with us. We have the description of the Lifted Lotus below, along with promos, and I believe there is an event coming up.
Yes, we are hosting a few events coming up. We have one that is geared towards endometriosis, movement, and pelvic health. And then in the future, we're also hosting a prenatal class. So it's prenatal movement with Pilates, as well as pelvic health education. So trying to get the word out about these pelvic health concerns and what you can do about them to address it.
So excellent. So look more in the description. Look for a link to their social media, along with the website, along with some promos. Thank you for tuning into this episode of Must Know, from my modality to yours. See you in the next one.
Stephanie.